Hi, I'm Dr. Heather Moore, owner of Total Performance Physical Therapy. Today we're going to talk about knee pain with running. This is probably one of the #1 things that we treat here at Total Performance, is the fact that people get knee pain when they're running. And they don't do anything, there's no fall, so they don't understand. One of the things you have to realize about the knee is that when you have knee pain, it's not really coming from the knee. You have all these muscles from the hip, from the foot, from the ankle, from the calf, that all come up and attach at the knee. So the knee is like the hub of the lower extremity. So a lot of times, pain at the knee, unless it's a meniscus tear or you actually did fall on it and bruise a bone, is coming from muscle imbalances that are coming from higher and lower. A lot of times with running, especially if you experience pain when you're running, and like 2 or 3 miles in, it goes away. It didn't go away. Your body compensated for it. You change the way your foot hits the ground, which changed the way your knee reacts, which changed the way your hip reacts, so on and so forth. So a lot of times when you're running, the knee pain you're getting is actually due to a weakness in your hip, and it's actually due to some issues coming from your foot. Now there are about 1,000 different things that can go wrong when you're talking about knee pain and running and what you need to look for. One of the first things that you can do to test, see where your issue is just start doing a single leg squat. How far are you able to get down? Ideally, a runner should be able to go to the floor and come back up without the assistance of the other leg. You also want to watch, is your leg wobbling? If your leg is wobbling, that's indicative of some hip issues that you need to work out. If you are not on a foam rolling program for your knee pain, you need to be. Foam rolling is one of the greatest things that is going to knock out that pain. So we have other videos on our site that will show you how to do a foam rolling program. But you absolutely, 10 minutes every day, have to start doing a program for foam rolling. One of the other things you need to watch when you're talking about knee pain is foot strike. Now I know a lot of people understand what foot strike is, and maybe you don't. If you are a heel striker, meaning if you're running and you're doing a foot strike and your heel hits first, you are setting yourself up for severe long-term knee pain. And you're actually putting the brakes on every time you hit the ground. If you are a mid-foot striker, that's ideal. So that means you're hitting somewhere in the middle of your foot when you hit the ground. And then you can run on your toes. The biggest problem people have is being a heel striker, leading to knee pain because of hamstring weakness, so on and so forth. One of the worst things you can do is get a shoe that forces you to run on your toes. If you are not a midfoot striker or you are not a toe runner, stay out of the shoes that cause you to go up on your knees. So some of the things, I'm going to give you 3 exercises that can help you with your knee pain. All they are a hamstring stretch, piriformis stretch, and a gastroc stretch. Ideally, you're doing these 3 things on a foam roller, but if you don't have one yet and you're looking to start something right away, these are the best exercises you can do. Piriformis stretch, let's say you're right out before a run. All you got to do is bring your leg up to your chest, just like this. You're going to feel a stretch through the glute, through the hamstring, all the way down to the leg, okay? If you're really good and you don't feel a stretch, you can actually hold this here and lean forward to get more of a stretch. Or you can place this foot on a table and lean forward. For a hamstring stretch, you're going to put your foot up in front. You can put it up on a raised surface. One of the biggest problems that people have with a hamstring stretch is they do this, okay? All you're doing is stretching your lower back and herniating your discs. What you want to do, sit up nice and straight, bend at the waist, and go down as far as you can until you feel a nice stretch in through the hamstring. Shouldn't feel pain, shouldn't feel numbness and tingling. So make sure that you are not feeling any of those things. Otherwise you're stretching too much or there's a greater issue going on. Final thing is a gastroc stretch, or a calf stretch, or whatever you want to call it. So you're going to put 1 foot behind, 1 foot in front, and you're just going to lean forward. Now you can also do this by putting your toes on a curb and dropping down real quick. 30-second hold 6 times for each of those stretches. Make sure you're doing them at least that long. You can do them before you run, you can do them after you run, whatever the case may be. If you're experiencing knee pain, We do offer a free 10-minute consultation to see where that knee pain is coming from in order to help you get to race day. So just click on the box above and it'll take you to a contact form where you can fill out your information, and we will get in touch with you and get you scheduled for an appointment.